The Bourbon virus is a new virus that's been discovered with the help of our astute colleagues at the CDC. It is a orthomyxovirus, orthomyxoviridae, and one of the types of virus in that is influenza. But this is not related to influenza in that sense, as far as the sense of illness. It appears to be a tick-borne illness. It has, its genome is similar to viruses that have been found in Eastern Europe, Africa, and Asia. But no virus like that has been ever identified in the Western Hemisphere. Those other viruses that have been, that it seems to be related to, there are very few cases reported to cause illness in humans and animals, but certainly nothing as we have seen here. This one differs in the fact that we've never seen it before, and obviously the only patient that we have seen with it unfortunately passed away and had a less than optimal outcome. And that caused a lot of frustration for myself and the other medical personnel caring for him, because we just couldn't answer questions to the family and to ourselves as to why this was happening to this gentleman. Although unfortunately we don't know the full spectrum of disease, because it's the first case. So does everybody who get it have the same outcome, or are there some more mild cases and people recover? And we just don't know that at this time. Typical symptoms of tick-borne illness that we normally attribute to things like Ehrlichia, Rocky Mountain spotted fever, possibly even Heartland virus, would be fever, malaise. With Heartland virus and with this new Bourbon virus, what we've seen is that anorexia is a major symptom as well. They just feel bad and they just don't really feel like eating. Sometimes muscle aches or myalgias can be a major symptom as well. And then also in your labs, we look at your blood and we can see that some of your blood cell lines are decreased, such as your platelets and your white blood cell count, but also your liver enzymes seem to be elevated also. For bacterial tick-borne illnesses such as ehrlichiosis or Rocky Mountain spotted fever, or even Lyme, there are standard, very good therapies. The main one is doxycycline, which is a generic medicine, which has been around a long time, and it's dosed at twice a day. And it's just a pill you take twice a day. And people generally have very good improvement in the first couple days after getting the therapy. Unfortunately, with viruses, there's essentially no treatment available for a lot of our viral illnesses. And so even this doxycycline would not have worked. In the tick months, such as April to September, is what we normally see for tick-borne illness is the normal time. But more recently it's been warmer in September and into October. So any time I think that you're going to be out in the brush or the wilderness and have exposure to ticks or insects, I think it's important to use obviously long clothes to prevent ticks to getting physically on, but also insect repellent with DEET is probably the best method of prevention. And then obviously when you get back, do a tick check, whether it's you or your spouse or somebody to help you do that, to look for the ticks.